They're in pain, you offer help, and they snap. "I'm fine! Leave it alone!" It's not denial, it's fear, pride, and something even deeper. Why is it that, when you see someone you love struggling, your offer of help can feel like a threat instead of a gift? Let's look beneath the surface to understand why elders often refuse medical care and how you can gently support change without turning it into a battle. Refusing medical care isn't simply a matter of logic or stubbornness. For many older adults, it strikes at the heart of who they are. Imagine living a lifetime defined by independence, by making your own choices, by being the one others depended on. Suddenly, the suggestion that you need help or that your body is failing feels like a verdict. You're losing control, you're becoming a burden, you're not who you used to be. Accepting help can feel like surrendering a part of your identity and the sense of dignity that comes with it. It's not about the walker, the pill, or the doctor's visit. It's about holding on to something precious in the face of change. The psychology of resistance goes even deeper. Loss of autonomy is a profound psychological threat. For elders, every medical appointment, every new prescription can serve as a stark reminder of mortality, of decline, of a future that feels uncertain or frightening. There's the fear of diagnosis. What if the news is worse than I imagined? What if I'm told I can't live the way I want anymore? Layered on top is the pride and stoicism of a generation raised to just deal with it, to keep pain private and emotions close to the chest. When an elder says no, it's rarely a rejection of you. It's a protective act, a way to preserve control in a world that feels increasingly unpredictable. So, if the usual arguments, logic, pleading, even guilt, don't work, what does? The path to change starts with shifting the power dynamic. Instead of telling, try asking. Would it feel better to talk to someone, just to rule things out? This approach offers choice, not an ultimatum. It acknowledges their agency and makes space for their feelings. Next, tap into what matters most to them. Instead of saying, "You need this," reframe the conversation. This could help you stay independent and keep doing the things you love. When help is positioned as a way to maintain freedom, rather than take it away, the message becomes much easier to hear. It's also important to normalize hesitation. You might say, "A lot of people feel unsure at first. It's okay to feel that way." By acknowledging their feelings without judgment, you reduce shame and lower defensiveness. It signals that the struggle is human and they're not alone in it. Most importantly, let this be a process, not a push. Don't expect an instant yes. Trust is built with calm consistency, not emotional pressure. Even small signs of openness, a maybe, or a willingness to listen, are real progress. Change is rarely linear, and it often unfolds in tiny steps. When your loved one says no to help, try to listen beneath the no. There's a fear, a story, and a lifetime behind it. Real change begins when we stop trying to win the argument and start working to truly understand. Remember, you're not alone in facing this challenge. Many families walk this path, learning as they go. With empathy, patience, and respect, it's possible to support your loved one without sacrificing their sense of self.